and we have a fully implemented clinical information system that integrates both clinical and administrative areas. And well, as part of we have a Department of Health Informatics, and we have a master's degree program, a residency training program. And we started last year this magazine, and we want to share with all the community in Spanish all the different advances that there's going on the field. We launched our first issue when we have our annual meeting that is on late November, no, late October, depending on when Thanksgiving is, but we usually want to have it in November. Mm-hmm. And it was number 15, if I'm not mistaken. And this time it was virtually. And we have over 7,000 people that attended the 3 days.
Wow.
Yes, we were really, because actually we have reached our limit in presence. There were 2,000 people because it's a free event, and we had people coming from all the country and the neighboring countries. But since we were obliged to do it online, we were really happy to have it.
Yeah, more
so
people.
Maybe next year we can have you also as a keynote speaker.
Oh.
How do you pronounce your last name?
Kvedar.
Kvedar. All right. You know, I remember that the first time I heard you was in a hymns in 2008 in Orlando. Okay. That you gave a small talk and you gave us a small pamphlet of what you were starting to work. Am I correct?
I think so. Yeah. No, I was at that meeting for sure. Yeah.
So I remember listening to your talk. It was in a big room. There were like small areas, and I remember I heard your talk. So thank you very much for accepting this interview. We have a set of questions, and we try to make it real quick because by 9 you have to leave.
Okay.
So the first thing is we were planning to use your short bio as a presentation. Mm-hmm. Because I think it has what your background, what your chair at the ATA, and what you're working on the Internet of healthy things. Sure. So when you published your book in the year 2015, you said that by 2020, millions of objects, of everyday objects, were able to capture, receive, and share health data through the Internet.
Yeah.
Now that we are in 2021, what do you think that has evolved to? And if you think that the use of all these devices can change how people behave regarding their health and also as a society?
Well, I think that prediction has come true. And of course, it's not just health, but there's like Nest thermostats and all sorts of Ring doorbells. There's all sorts of things now that are internet connected that talk to one another, and this Internet of Things concept. In terms of the health implications, I think they've lagged in some ways. In some ways, they've gone exactly as we would have predicted. So the way that things have gone as we would have predicted has to do with people getting feedback on their own health and responding to it, whether it's through a step tracker or a device that gives you feedback on your sleep patterns, or an Apple Watch talking about your heart condition. All of those things are making consumers more aware of their health. And again, feedback loops are powerful because awareness creates usually some desire to change or to use that information as a metric to measure. And so that is certainly flourishing. The way it's lagged, at least in the US, is that healthcare providers haven't quite found the market yet to do a lot of this remote monitoring with their patients. It's coming, it's happening. It's not happening as fast as we would have liked. So, and then when the pandemic came, the good news, telehealth is now a household word, but it's really all about virtual video visits, and remote monitoring is kind of next on the evolution. So again, it will happen. We're a year or two behind where I thought we would be in that regard.
Yes, I guess regarding that, the pandemic helped us in, relaunch all the telemedicine efforts that were going on, and now let's hope it stays and doesn't go away. So what you were saying, it comes with, the next question would be, what do you think the advances will be in the next 10 years regarding, because as you said, right now we capture the data and we just provide that information. But regarding diagnosis, maybe IA algorithms and disease management, a quick management of information, where do you think in the next 10 years the Internet of Healthy Things would go?
Well, you mentioned artificial intelligence. That's a big part of it. That's really growing and changing very rapidly, much more rapidly than any innovation that I can think of in our history in healthcare technology. So that the idea, and I alluded to this in the book, but the idea will be that there, first of all, taking multiple different data streams about you. So we talked earlier about things like tracking or maybe your sleep patterns, but your breathing rate, your heart rate, your geography, where you've been walking, your mobile spending habits on your credit card, where you walked into, your location-based service says you walked into a fast food joint for lunch. All of that will become part of a way for software to say to you, Paula, these are the things you need to work on today because of all those behaviors. And again, people generally tend to respond to that. So that's the next phase, is not just saying, well, your step count was off a little bit and reminding you of that, but giving you this really integrated view of your health driven by artificial intelligence and multiple data streams. So that's a big one. The other, I think, that's just worth mentioning is this idea of the power of digital biomarkers. And one example, and I should disclose I'm an advisor to a company in this space, but this particular firm, based on the sound of your cough, can diagnose respiratory illness. There are others that, based on the tone of your voice, can diagnose your behavioral health status. So more and more of that will feed into these algorithms as well, and that's a powerful input.
Great. So when you were saying this, that people tend to pay attention to this kind of information, how about privacy? Because we're saying that we are going to share all that data around, and it's a big issue, because remember when all these apps that were supposed to track your location in order to tell you who are in contact with, they became a huge problem, because in many countries, the people might accept it regarding how they behave as a society. It's not the same in the US, in Argentina, in Japan, or in Singapore. So what do you think about that?
Well, it's critical. Privacy is I feel very ambivalent about it, because of course it's critical, and yet I have to say, I'm not sure that GDPR is a particularly good response. Every time I hit any website now, I've got to click on that it's okay with cookies. I might hit the same website 10 times in a day and still have to click that button. That doesn't seem like a good solution to me. But I know it's an effort, and again, I want to be respectful of people's privacy. The big issue with privacy and health is that we filter our behaviors, our goals, our aspirations through a very powerful cortical filter in our brain. And my example of this is when I go in to see I just during the pandemic increased my exercise, but I used to work out on weekends, and my doctor would say, how often do you exercise? And I'd say twice a week. But some weekends I travel, and some weekends I didn't get to it. And so, an exercise program he could look at that and say, well, actually, Joe, it's 1.2. And somehow that would be an invasion of my privacy, but it's also a reality check.
Yeah.
And so I guess I don't quite know how to sort that all out. I think we need the clarity of that data to guide our health behaviors. And maybe the solution is, you, Paula, get your data, and no one else has any access to it. That's the privacy part, but it's still all those filters coming together. I don't know if we can solve that or not.
No, I know it's a hard question and doesn't have just one answer. We have to just let it mature, and in the end, it's going to depend on everyone what you want to share, and what is the benefit you get back by sharing that kind of information.
The other thing I say sometimes, and it's a little bit harsh, but in the U.S. anyway, because of the way our health is insured, I can choose my whole life behaviors that will make me chronically ill and sick, and then society ends up paying the bill for that. So I could say, we could, again, this is draconian, so I don't see it anytime soon, but it's a point counterpoint thing. We could say, oh, well, you don't have to share any of those data, but your health insurance premiums will go up because you're not participating in this program that will make you healthier. So that's just another way to look at it. I think at some point we're going to have to come to grips with some of those things.
Yeah, definitely. That I think that in the US, the 5G mobile technology is growing. In Argentina, we still are far behind that.
Yeah.
Do you think that it would help to help in the advance of the Internet of Healthy Things?
Oh, of course. I mean, 5G, I haven't experienced it myself, but by all accounts, it is an enormous leap. Now, I have to say I was skeptical because 4G didn't make a big difference in my life, but by all accounts, 5G is amazing. And so being able to have those things instantaneously happening with no lag undoubtedly will lead to some really powerful advances for sure. So I look forward to it.
Yeah, but the thing with 5G is maybe it was the big leap, but how do you get 5G or not only the big cities, but all throughout the countries where everyone needs it, no? And
right.
That comes with my next question, with the digital divide.
Yeah, equity, yes. Yeah.
Equity. And that, I think that the pandemic has shown the great inequities that are at all levels.
Really
right now with the vaccines, how every country handled the pandemic, and it has shown that as a world, as a society, we are doing things wrong. And people that are at the lowest level of their income are the ones that get more sick and they die. Yeah. So do you think that the Internet of Healthy Things might help? How do you, maybe I'm asking too much, but what is your position regarding the digital divide and the quality of care and the patients to the access of care? Because you're a dermatologist, so you see patients.
Sure, of course. It's a critical, and you've said it, I'll just echo some of the things you said to start, which is the pandemic laid bare so many disparities. So some of the things we're trying to do in the US as a result and a response and advocating for, you mentioned my ATA role earlier. So ATA is very committed to dealing with disparities. One of the things we're advocating for is universal broadband. It should be a human right. It should be a public utility, not like the roads that we drive on. So, and there's a chance with the Biden administration and their attention to infrastructure spending that we might actually get something done. So we're continuing to be optimistic about that. The second one is begging, that's the wrong word, advocating for our payers to continue to pay for audio-only telehealth, because just about everyone in the US has a phone. And so even if you don't have a smart device and you can't do video, you have a phone. And we can do a lot of telehealth by audio only. Mm. And if payers choose not to pay for it, again, it lays bare another level of disparities because so many people who can't afford either the broadband or the smart device won't be able to access care. So Those are two examples. They're not really Internet of Healthy Things examples, but they're
No, but it's related.
Yeah.
So now it's my last question because we are running out of time.
Mhm.
So you are president of the ATA, and based on we talked about this, but we would like to make it as one topic of the interview.
Sure.
Based on the experience that COVID-19 has left us for a whole year, what do you think that telemedicine has shown to be effective, and what is in the road ahead? What telemedicine might provide, and what will happen after the pandemic?
Yeah, thank you for asking.
We have to end this pandemic sometime in the future.
Sure, sure. No, it's a great question. So I start by saying in the middle of March, this is the US experience, but in the middle of March, we suddenly said people have to stay at home. We're going to have to provide care. Unless you're really sick, don't come to the hospital. And telehealth flourished. So between mid-March and mid-May, 300, 500, 1,000% growth in all these sectors, whether it be the vendors or the healthcare providers. Everyone saw huge growth. Patients now know what it is. They've all had telehealth visits. Pretty much all the doctors have used it. Huge, huge boost forward. And the things that it's really good for now, we'll talk about the future in a minute, but the things it's really good for now, virtual urgent care. So all those things that you would go to urgent care for, chronic illness management, and some new problems, but mostly follow-up visits, chronic illness management, and of course, behavioral health, right? Behavioral health is really number one. As we get more things like more home devices, I mentioned before, the digital biomarkers, home testing, lab testing. As we get more and more of those in the mix, we'll get more and more use cases for telehealth, because not only will you and I, or your patient and you, be doing a virtual visit, but you'll have more information on which to do decision-making to make it a more powerful experience. So that is part of the future. We're now in what I call a hybrid environment, or a two-channel healthcare delivery environment in the US, where about 20 to 30% of our ambulatory activity is telehealth now. We expect it to stay in that range. We're paying close attention to how our insurers reimburse after the public health emergency is lifted, but we're very optimistic. And so that means we triage differently when people come to schedule appointments. We use provider time slightly differently. I do my telehealth sessions from my home office. I'm using different overhead structures, and if I was in the clinic with a nurse and a receptionist and all that. So we're thinking through all of those parameters for the future, which, as I say, is very bright. And then the other thing, of course, that although virtual video visits became the big news of 2020, as you know, there are other, in some ways, more powerful tools like asynchronous visits, where we're exchanging information much more efficiently with our patients. Say, for me, they send me a picture or two. I can say, oh, that looks like your acne is doing better, and prescribe without a real-time interaction, and very powerful. And then remote monitoring, which we talked about earlier in the context of the Internet of Things, that's coming as well. So those are also part of the future, I think. So figuring out brick and mortar, figuring out what it means to triage in a hybrid environment, remote monitoring, and asynchronous.
I remember that one of the issues for telehealth in the US, the same happens in Argentina, that you have to be licensed in the state in order to practice that. What happened during the COVID? That was not taken in account, or you could only see patients that were on the area that you were licensed to practice?
No, 49 out of 50 states have loosened their licensure requirements for the duration of the public health emergency. So it's not completely seamless to do cross-border telehealth, but it's much, much easier. And frankly, everyone's looking the other way because we care so much about patient care. What will happen after the public health emergency is lifted is not clear. There's a lot of doctors in a lot of states that are scared to death of this because they see it as a geographic monopoly, their job. So it's going to be a long, hard fight, I think, or challenge, but maybe there'll be regional compacts. So maybe, for instance, the New England states and New York will have a licensing agreement so that we can do cross-border telehealth. We'll see how that goes.
Good. So we are in time. Thank you. Would you like to say something else, or what are your next plans? Are you planning a new book? What are you working on?
Well, in January of 2020, I took on the role as editor-in-chief at Nature Digital Medicine. So that's kind of my editorial outlet right now. It's actually several hours a week of my time. It's a lot of, it's a good use of time, but I don't right now have the time to do another book. So we'll see.